This is a strategic plan for improving care for the post-operative pregnant patient population at Banner Fort Collins Medical Center. Banner Health's mission is to make healthcare easier so life can be better. We identified a category at risk that may not be receiving the appropriate care. These are our pregnant, post-operative patients who have undergone surgery for a non-pregnancy related condition. This has affected staff, resources, patient placement, and routine post-operative follow-up. The strategic goal to develop a process and workflow to better care for our post-operative pregnant patient population after having surgery that is not related to pregnancy through education, interdepartmental collaboration, and partnership between nursing staff and physicians by March 1st, 2019 at Banner Fort Collins Medical Center. This goal will be measured through patient, nurse, and physician satisfaction survey results specific to these patient, nurses, and physicians involved in the care, as well as clinical outcomes relating directly to hospitalization. This is important because recently at Banner Fort Collins Medical Center, we have had several pregnant patients undergo surgery for non-pregnancy related conditions. These patients have then been transferred to the mother-baby unit for post-operative recovery. Mother-baby nurses have expressed several concerns on the adequate care that mom is receiving. These nurses have little to no training in post-operative patients, minimal experience handle complex medical conditions, and the nurses felt as if baby was becoming the priority instead of mom. Little to no interaction was had with hospitalists or surgeons post-operatively. Upon discharge, the patient was then asked to follow up with their OBGYN, and often information regarding post-operative care was not informed to the patient. OBGYNs felt as though a hospitalist or surgeon should be following this patient's care. While baby is an important patient, the mother and her admitting medical diagnosis is the reason she is there, and this should be treated first. The new workflow would include that an OBGYN will be consulted if any patient is pregnant and is in need of surgery. Every pregnant patient undergoing surgery will either have a preoperative ultrasound or fetal heart tones performed with a Doppler done prior to surgery to give a baseline. A registered nurse from mother-baby unit will come up to perform the fetal heart tones, and an ultrasound tech will perform an ultrasound. The next steps are determined based on gestational age. Under 20-week gestational postoperative care will include that the patient recovers in our post-anesthesia care unit until she is stable and ready to be moved to her room. Postoperative fetal heart tones will be performed in recovery by a mother-baby nurse. Anesthesia, surgeon, and OBGYN will be informed of the heart rate. Any further tests or recommendations will be done per physician request. When a patient is ready, she will then be transferred to the inpatient medical unit. Patients will there have fetal heart tones monitored once every 12-hour shift. These results will be documented, and out-of-range results will be reported to the OBGYN on call. Patient will be followed by a hospitalist with OBGYN consults and routine surgery follow-ups. Mother will be the priority in care with a focus on monitoring baby. 20 weeks and over gestational postoperative care will be extremely similar to under 20 weeks. The main difference will be these patients will be receiving a non-stress test every 12 hours instead of the fetal heart tones. These stress tests will be performed down in the mother-baby unit, so mom will have to be transported there once a shift. The results will be given to the OBGYN on call, and more tests or additional procedures will be per physician request. The importance of this is mother's underlying medical condition is what is needed to be treated. In order for the baby to be healthy, mother must be healthy. Mom will receive more appropriate care on an inpatient medical surge unit than she will on mother-baby. If the situation arises that a baby's health is more of a concern, mom will then be transferred to mother-baby unit, and OBGYN will take control of primary of her care. This information will be given in a strategic goal that is led by management by objective system. Managers and employees will define goals for every department, project, and person and use them to monitor subsequent performances. 4 steps will be used: set goals, develop action plans, review processes, and appraise overall performance. A change team will be created, which will consist of the chief of surgery, head of obstetrics, manager of surgery, lead hospitalist, and 2 nurses from each of the following units: mother-baby, inpatient, and post-anesthesia care. The change team will be responsible for defining models for each department and doctor. This includes models for post-anesthesia care unit nurses, mother-baby nurses, inpatient nurses, emergency room doctors, surgeons, OBGYNs, and hospitalists. They will also review all pregnant surgery cases monthly and determine if the appropriate course of action was taken with each patient. Clear, measurable goals with timelines will be given to each department and physician. They will also review all staff, patient, and physician satisfaction surveys associated with this process. Financial considerations include the purchase of 2 additional fetal Dopplers, one for the postoperative unit and one for the inpatient medical unit. This will also include training and competency evaluations for the use of fetal Dopplers. Benefits for this initiative include adequately trained nurses for the care of mother's medical condition, more available space for laboring moms from the community, increased coordination and collaboration among physicians, and cost savings with reduced time in the post-anesthesia care unit for our patients. The information will be presented in 3 steps with a transformational and team leadership style. We will first inform stakeholders of upcoming change initiatives. This will be done by emails and conversations, as well as media and press coverage. We will include key points with times and locations of the upcoming open forum sessions. The open forum sessions will be either specific to hospital staff or the community and will be in person and online. The final step will be the information distribution. This will be done with handoffs, blogs, emails, PowerPoints, and audio. The goal of information distribution is awareness, knowledge, discussion, self-efficacy, behavioral intentions. Community-specific goals include a focus on the health-related decisions and clinical outcomes, and medical professional-specific goals include behaviors and actions needed to achieve the strategic plan. With your help, we can help this at-risk population and make sure that the best care is given to our pregnant postoperative patients with a strong emphasis on requiring medical treatment for mom and also making sure that the baby is monitored.